Hi, my guests today are Ken Welch, who's the Executive Director of the Coalition, formerly known as the Coalition for a Better Wallingford, and Stephen Civitelli, who's the new Department of Public Health Director for the town of Wallingford.
How you doing, Craig?
Thank you so much for coming. I think what we'd like to do is give the audience a chance to get to know both of you a little bit in terms not only of what you do, but what you do together to improve the health and wellness of the citizens of Wallingford, particularly children, but not exclusively children. So I'm going to start with you, Ken. Can you just give a brief history of the Coalition, and then we can talk a little bit about the programs that have come out?
Well, we were formed 7 years ago on the heels of a scourge of overdose deaths that the town experienced. A good number of those were kids under 26 years old. One of them was my stepdaughter, which is why I got involved with my wife, Jen. And we've almost come full circle in that we've learned that it's a much bigger problem than just drug abuse.
Can you talk a little bit about that? Because I think that's important for people to realize that it started with a particular emphasis on just one topic, and then it's really turned into a much more holistic approach to just healthy families and healthy people.
Well, you just said it, and that's why we're here together to talk about that, because it's a serious public health threat, and from a lot of different angles. I mean, we're the community kind of speaking out from an awareness standpoint of the things we're seeing and experiencing, and a good number of those are addressed in the health department, in youth and social services as well. But more and more, they're turning in the direction of having a stronger, more broad-based health department to oversee some of these influences that deteriorate families.
Right. So before we get to the influences, Steve, that Ken's referring to, I think it's important that people have an understanding, too, that your coalition is active. You have a very real physical presence in town. You want to talk a little bit about your space,
Sure.
What's available there, and how people can reach out to you.
So it's we have somewhat limited hours. We're right on Center Street. We got the space a little over 3 years ago with the help of some funding from the town, which has been great. We've been grateful for. But having that presence has raised eyebrows around the country, certainly throughout the state. Within 6 months of us opening up basically on Main Street, we had both state senators visit us, touting the awareness and the visibility of what we do and how we do it. Not surprisingly, there was a number of people in that area in the Merchants Association that weren't in favor of us taking that space on. Felt that we were still a backroom organization and should be working from the shadows, so to speak. So, you know, we've come a long way from being a redheaded stepchild to being the forefront and getting the support. I think a very broad-based support throughout town.
I know that when that started, in terms of you having a physical presence down there and being visible to not just the community, but to the individuals in organizations downtown, both good and bad, that was one of the first connections, actually, between the health department and the work that you were doing in our department, because we were trying to kind of clean up the negative side of what was downtown. And there's one aspect of doing that by just approaching people that you're not sure of the nature of their business or their products that they're selling or what their particular agenda may be downtown. And some of that can be handled by the licensing practices. And
we had those conversations,
Yeah, and I know that I don't know if you want to speak a little bit about that in terms of some of just making sure that the people down there were promoting or producing or displaying products appropriately or not, and if they were not, in terms of being accessible to children, how we handle those sorts of things, and more the role that the public health department is as an enforcement arm to ensure that businesses are doing business the right way.
So when you're focusing on population health, we have our town health improvement plan, but we also have, as you mentioned, the enforcement side of it. And we license all the daycares, all the food service establishments in town. So when we're looking at it from a broad spectrum, we're trying to make sure that if we have any control over it, the way the businesses operate is in the best interest of the town.
Yeah, and I think that's important because historically, government is seen as being kind of strong-arming and coming in with a punitive approach and looking for things to catch people, but it's really more about protecting the public and ensuring public health and safety.
We have a mantra within the office. We call it the 2 E's, enforcement and education. So we've been using that for years. So a lot of times we'll lead with the education. We want to show you how the regulators are looking for you to do something, for you to react in a manner that is appropriate. And then if we find that we're not getting the results we need, then we move to the second phase, which is typically the enforcement. So that's what we're...
That's great.
We've had a good example of that just this last year. So everybody's aware of the vaping epidemic. I think we can legitimately call it that now. Enough numbers are in, enough feedback is in. You brought somebody to town from Yale. We met her, talked with her, saw some of the data, started talking to parents about this, realized that there was a serious problem. Lots and lots of kids were vaping, and the long-term news was not good. Talked to Steve. He really spearheaded the move to change the law. Met with the town council, convinced our town attorney to do the research. It was a heated, controversial issue for months, and yet we were one of the first in the state to change that law. Right. and raise the age from 18 to 21 in hopes that we could take the vaping and the nicotine, the cigarettes out of the schools, which is where we were seeing the problem.
Yeah, and I think it's worth emphasizing that there were a number of towns that were also doing that simultaneously for the most part. I think a couple were ahead of us, but most followed up with an intent to have enough towns be passing a local ordinance that the General Assembly in Connecticut would have to take a look at that as being a public policy issue at the state level, which indeed they did. And just October 1st, that law went into effect, where purchasing tobacco products and possessing tobacco products now is restricted to people 21 and older.
But I think that if just the data generators, we know from history that if just the people generating the data come with that information, that doesn't move anybody off the dime. I don't know that just the health department, screaming wolf, would have done it. And certainly we're probably the least influential in a community, but together, when we joined forces, nobody could deny the fact that this was a public health threat and that there was benefits in moving off the dime here.
That's something that we're really working on, is that the public-private partnerships and working collaboratively within the community to address needs. In this particular case, it was vaping. We've worked on other initiatives within town that are addressed in the town's health improvement plan. So that seems to be the model for how we're going to move forward in addressing community-based issues.
Yeah, let's talk about that a little bit, the health improvement plan. So explain for people that may not know how that came into existence and really where it's progressed so far in town.
So it's been a few years now that we've had a town health improvement plan. It started with Healthy People 2020, and they had the State Health Improvement Plan, which is also known as the SHIP. And what the town did is we actually modeled our own health improvement plan off of a community health assessment that was done in town. And basically that health improvement plan is administered by the Wallingford Community Health Alliance. And so the members of that group will actually work through the plan in certain focus areas to try and address the community needs. One of the areas of need is substance abuse, and that's where the coalition comes in. So we lean on Ken a lot and other town partners to help address that area of the health improvement plan.
Do you want to speak to some of the other areas that are in there that are priorities?
So we have Healthy Homes, which is something that falls under the health department, which deals with lead poisoning prevention in children, asthma prevention. We also have the Eat, Play, Unplug initiative, which talks about healthy eating, recreation within the community to try and promote a healthier lifestyle. So those are two of the bigger ones, along with substance abuse, that we work on within the plan.
So I know that over the last year or two, one of the major themes that has kind of been an umbrella over the whole issue is the notion of kindness.
Correct.
Can you speak a little bit towards where that's gone?
So last year at Celebrate Wallingford, we did our Kindness Rock Garden, and I think it was well received. Everything, all the rocks were painted and displayed in front of Town Hall. This year we're actually going to do a pumpkin display that we're going to encourage the residents to write healthy kindness type notations on there for the future. But
Steve,
again,
those rocks are everywhere.
Everywhere.
They're not just in front of the town hall.
We're trying to build a base of kindness, and then it grows over time. And we find that if you're kind to one person, you have that butterfly type effect where it could spread throughout the community. And that was the original thought behind it.
Yeah, it's great. I know that there are still remnants of those rocks out there, and probably after this weekend there'll be pumpkins instead. I know that's one of the activities for celebrate this year. So we'll cheat a little because people will see this after the fact. But how many pumpkins?
So we have 500 pumpkins that we actually are going to have delivered Friday evening for the event. We went through 500 rocks last year by 2 o'clock in the afternoon on Sunday, and it was definitely a big hit for us. And really the focus for us was vaping, showing kindness through expression within the kindness rocks, and we have the ability at that point to also highlight other services that the health department offers that people may not be aware of. So the public health department is typically the silent partner in the community. We're inspecting facilities that people are eating at. We're conducting nuisance complaints that people may not be aware of that have an impact on neighborhood preservation, for lack of a better term, and that's our primary focus in some areas.
Yeah, and I know that, so just from the perspective of the kindness initiative, I know that just having that presence, particularly at Celebrate, but in the center of town, kind of stimulated other groups. I know some Girl Scout troops picked that up, and some other organizations, we picked it up to a degree here as well. And I think that's an important message that people assume and take for granted. They don't really realize the power and persuasiveness in terms of just establishing kind of a spirit of kindness in the community if people are really thinking that way and acting in a kind manner, because it's so easy to do that sometimes we forget how important it is.
Agreed.
So when we come back in the second chapter here, I want to talk a little bit more about some of the other initiatives that we're involved with, particularly on the side of recreational marijuana, which we've talked about, but just the greater notion of the alliance, because there may be people out there that have an interest in participating in that in some capacity, even if they're not on the standing committee. There might be other groups, subgroups that they might be a part of as well. I think that'd be great.
Great, thanks.
Thank you.
And we'll be back. So I'm back with Ken Welch from the Coalition and Steve Civitelli from the Town Department of Health. And I guess one of the things that I want people to have a chance to understand and hear opportunities of perhaps even getting involved is kind of the collaborative aspect of what we've been doing. So Ken, I'll start with you. Describe a little bit about how that works for the Coalition, both with organizations in town, but more importantly, neighborhoods or individuals that really want to see positive change in their area where they live.
Can I first talk maybe for a minute about some of the things that we've done?
That'd be great.
That I think that have led us to that.
Sure.
So we have been always interested in getting to teens and getting them before they get into trouble. And started a number of initiatives like open mic night and trying to lure the teens into there, and found out that we were getting some, but it really wasn't the numbers. So we went to the youth serving organizations in town, SCOW, the Boys and Girls Club, and the YMCA, and found out that they weren't doing any teen events. Zero. So we talked to them and provided pizza and soda, and they are all doing teen activities now. And most recently, the YMCA, within a year, went from 15 to 20 kids on a teen night to over 100.
That's great.
Because that focus has became, what we intended it to be. That came as, and they didn't do it because the Boys and Girls Club were doing it. They didn't do it because Scout was doing it. They did it because it was making sense to them. So even though some of the messages that we have been difficult to swallow, the whole idea that we really do have a drug problem, like the rest of the world,
Right.
the good that we're trying to do is being accepted and embraced, and that's created an environment for collaboration amongst like organizations that can accomplish things. And they found that they can accomplish a lot more by working together than by putting up walls.
Right. So that's an important distinction, I think, because prior to that, my perspective was that everybody was kind of doing their own thing in their own silo world. And while there might have been some discussion or some communication, there really wasn't collaboration in terms of people coming into one another's spaces or sharing of resources and staff to really have a greater impact on the community. And I do see that change, particularly between the Boys and Girls Club, SCOW, and the Y.
Yep.
You know, they're very vibrant groups now, and there's a very active youth element across the board, and that has not been the case for several years. So that's kind of exciting.
I think all three organizations are talking about them bursting at the seams.
Yeah, and I don't think that that's a coincidence that it's happened at the same time that the work you're doing and the work that the Healthy Wallingford Alliance is doing, because those people are at that table. So a lot of the same messaging is getting out, particularly about kids, but not exclusively about kids.
Right. So we can go there, because there's a family element of this that's overriding. So you're talking about a narrow focus and then a broader base about families, and I think that's where our collaboration is coming in. And you can speak to the Community Day thing, in which we piggyback that with our annual family movie night.
That's a great example.
Yeah, so we've had our health improvement plan for years, and we talked about it internally within the office, and we really want to put the public back in public health and to actually reach the folks in the community and make them aware of what we're actually doing and what our plans to do moving forward. So we held a community day in August with all the partners that were part of the Alliance, and I think it came off really well. It was an opportunity for the membership of the Alliance to actually highlight services in the community that people may not have been aware that they had. And based on the responses that we got back from community members, it looks like we're going to be doing it again next year, and I have a feeling it's going to grow as time goes on, potentially piggybacking with other events. So that collaboration really moving forward with other town nonprofit entities or either municipal government entities, working together as a group certainly enables us to do so much more than if we're doing everything within silos.
Yeah, and that was done in the context of a very family, fun-oriented day. I mean, it was down at Community Lake. You had canoes and kayaks.
Pizza and ice cream.
And lots of games,
Music.
demonstrations from some of the youth-serving organizations in town. And, you know, everybody just seemed to get it.
Yeah.
You know?
Well, that night was our most well-attended movie night as well.
Right.
I mean, we filled the park until, 10 o'clock that night.
Yeah. So one of your other initiatives, which I find to be one of the most valuable and interesting, because I think it's unique. I don't know that a lot of other towns have really looked at breaking the town down by neighborhood and actually pursuing individuals in a certain area to bring your message directly to that geographic area. Do you want to speak about the neighborhood program?
Yeah, so it's twofold. One, it's giving everybody a voice. So we started out kind of saying neighborhoods really aren't neighborhoods anymore. You know, Connecticut as a state's known as a backyard state or back porch state, not a front porch state, where people are out sharing their activities. They kind of build the fences up and protect their family from the rest of the world. And we need to break that down a little bit. So it started out as an initiative to just say, hey, you got to know your neighbor. How many people know their neighbor? And we're reading all these statistics that nobody really knows their neighbor.
Right.
We're a transient society. But we did it in a way that was really, we didn't realize it was going to have the impact. So we made sure that town government was represented, the police department, the Board of Ed, the mayor's office, and a couple other agencies. And by having them in the crowd, people opened up. And it turned into something not even we could have predicted, because a lot of good came from that. Now we've coupled that on top of the fact that we have a better understanding of how to get to people, that people need their individualism, and that Wallingford is the largest town in the state, and that we are a bunch of neighborhoods. It's taking on even greater significance. So we're making that venue available to anybody who would like us to show up in their front yard or backyard, invite the neighbors over, get the town together. with all of those entities and have an open discussion at the community level, which takes away some of that antagonistic nature of challenging people for what they're doing.
Right.
It's more of a problem-solving environment.
Yeah, one of the things that I saw repeatedly in the ones that we did early on was that it was designed for people to share with whoever was there, whether it was the police, school system, or other entities, what their concerns were.
Right.
So if it was cars driving fast down the road, the police heard that and they gave a response. Or if there were broken street lamps, street lights, they had the opportunity for that to respond. And I think what I saw happening is that the people experienced being heard, and shortly after that, those issues were clearly addressed.
Yes, they
because
were.
we were hearing back in terms of how quickly the response was to the things that they brought up.
Some of that stuff had to go all the way to state level for code alterations to accommodate neighborhoods.
Yeah, and the other thing was, I know that the coalition and probably our office as well, to some degree, provided the refreshments and the setting just to make sure that people would be able to sit there and enjoy the opportunity. So if there are folks that are interested in contacting you about that,
yeah, please do.
Yeah,
we're doing it on an ongoing basis. We do the legwork. We put up the signage. We go door to door and knock on everybody's door.
Right.
They get a personal invitation.
yeah.
So, and they were well attended, and we accomplished an awful lot with them.
And I know in some cases even state representatives representing their neighborhoods were there as well, which I think was, that just showed the degree of, I think, commitment on the part of the people that have some role in responding to, the average individual's needs in their space, have an opportunity to be heard.
So we're about as transient is about as transparent as you're going to find in an organization. I would say if anybody wanders by or they're driving by one of those events and they see our sign, feel free to join us.
Right.
Everybody, we're not just a group of people doing our thing. Everybody in this community is part of the coalition. Right. And they have equal rights to voice their opinion and get things done as they see they should be. So, we have monthly meetings that offer an opportunity for that. We have a lot of events ongoing. So you should check out our website and see what our programming looks like.
Right. So from the perspective of public health and what opportunities might be available or ways to engage with the department concerning particularly the areas of concern that are identified by the WIP and those surveys. And I think maybe that's something that we haven't really touched on, is how we got to where we were in identifying those priority areas. So part of that, I know from our work, was the student surveys that we did in the high school, as well as conversations that we had with the people that we interact with. What do you use to determine what the priority areas are?
So you mentioned the WIP, and that's the Wallingford Health Improvement Plan. So we do a community health assessment to evaluate the needs of the community, and then when we actually devise the plan itself, the subsections of the plan actually address those specific areas. So again, I mentioned earlier some substance abuse, healthy homes, recreation activities, all those things are addressed and laid out in the plan, which are also required by the Department of Public Health in looking at the functions of a health department, being able to show your collaboration within the organization and outside of that with other municipal entities, as well as nonprofit and other types of organizations. So that's kind of what our focus area has been moving forward.
So I know we don't have much time left, but as a tag maybe to bring this conversation back for a second time, I know one of the issues that's come up time and time again, and we heard it today in a meeting of a number of nonprofit organizations in town, is the issue of anxiety for people, kids and adults both, and the need to kind of address that with either services or some sort of programmatic issue. And what can, I guess let me rephrase that. So from the perspective of the Health Alliance and the group that's in there, if people wanted to be able to provide direct input into that process as opposed to waiting for the survey phone call to take place, is there a way for them to either contact you or write you or submit their concerns?
Yeah, I would say contact us at the health department, and I'm pretty sure the phone number will be below my face right
Sure.
now.
Yeah.
But again, it's you contact us, and we'll actually, and if you show us some of the areas that you're interested in, even residents at large are part of the plan. We want everybody's input to it, so we want to build on that, what the community needs are.
Right. So I think that's the message I would want people to hear at the end, is that we're looking to build on the basis of what the needs are in the community, and we don't want to have to guess, and we don't want to be left out.
And again, it's a living document, so it's not going to be the same today as it is going to be 6 months from now as it was 6 months ago. Right. We weren't dealing with vaping 2 years ago. Now, last year was our primary focus was vaping, and moving forward, we'll be addressing other issues in the community. So again, that's something that we respond to the community needs.
Right. And from the neighborhood perspective, there are things that people think are not being addressed or being minimized or overlooked. There's the opportunity to get that information out either through the coalition or through the health department or actually through our department. You know, it's your community, and we want people to make sure that they have that opportunity to let us know what's going on.
Yeah, let us know what's going on, and if for whatever reason it doesn't fall under the health department's purview or even somebody within the Health Alliance, we could triage that concern and get you to the right department to try and make sure that that needs addressed.
Perfect. Well, thank you so much, gentlemen, for coming, and we look forward to a healthier, safer, and
Better.
happier, kinder community.
Great.
Agreed.
Thanks for joining us.